Hi, we're at the John G. Rangos Research Building, where our researchers are working on a new antidepressant. Johns Hopkins medicine researchers have found that more education does not necessarily protect someone against Alzheimer's disease. Ever feel like your doctor just isn't listening to you? Well, when dealing with heart disease, this could be deadly. Coming up, Johns Hopkins researchers are finding ways to determine whether a cancer drug is working. Practice makes perfect, but did you know that too much practice can undo all of your hard work? Are you guilty of missing your meds? Well, our doctors are developing new tools that can help you keep on track. Johns Hopkins medicine researchers have created a tool which allows them to study these genetic combinations. The human reference genome is basically the blueprint for every genetic test medicine has to offer. Doctors and researchers use it to compare genes across people, populations, and diseases. If you're a science writer, you'll hear more research news on mental health and addiction at our annual Science Writers Boot Camp on June 10th at the National Press Club in Washington, D.C.
And the vagus nerve starts in the brainstem, the lower part of the brain, goes down your esophagus, and then goes into your stomach and also your large intestine. And it controls the digestive function of the gastrointestinal tract.
I routinely perform head-to-toe cancer, trauma, and cosmetic reconstruction.
The material itself is elastic and stiff, but at the same time, they're able to go through the narrow bore needle like this.
Scientists working in regenerative medicine, an area I'm very excited about is to try to restore those missing soft tissues by using the body's own regenerative mechanisms.
And this form of learning is what we call reinforcement learning, where he performs an action and then he gets feedback whether it is correct or incorrect. If it's correct, that movement is going to be reinforced and he will repeat it probably. And if the movement is incorrect, he will get a negative feedback, which is red.
It's being able to give those individuals that same second chance that I was given that really allow me to understand that we have a lot of work left to be done in order to make our community safer and prevent these senseless tragedies from happening.
Does it affect how severe the disease is when they actually come into the clinic with knee pain? And we were able to show that in many of the variables that we looked at, it did show increased severity with increasing B5 percentile. And that's sort of what our presentation focused on.
That women, compared to men, were more likely to report that their healthcare providers did not listen to them.
If you had a male physician and you're a female patient, are you more likely to be on these medications, or are you more likely to have to report poor outcomes compared with if you had a female physician?
We interrupt this program to bring you a special report.
I think anything that you do that translates to the public sector that you think patients or people on the street should know about, that's where the media relations team can be super helpful to get your message out there, not just to the other doctors who read the journals that we write the papers in. So any big high impact paper that's going to a major journal, if you're sending something to New England Journal or JAMA, when we have things published in JAMA, they should almost all go out to media relations, so the high impact journals. And make it easy for them. Send not a draft of the press release, but here's the paper and 2 sentences of why it's important and why the public cares about it, as opposed to just the researchers in your field.
When you're cramming on a deadline late at night or frustrated by a problem you can't seem to fix, maybe you've heard the advice to just go and sleep on it. Well, a recent Johns Hopkins University study shows that that's probably a good idea. The study was done in mice and found that while they were sleeping, their brains were hard at work reconfiguring lessons learned during the day, turning them into memories that changed the mice's behavior the next day.
We all have experienced not having a great night's sleep, and it really impacts both memory recall, remembering things in our past, but also we don't learn well if we're tired and sleepy. So I mean, this is something we all experience.
For Johns Hopkins, public health researchers were selected among 21 recipients to take aim at current and future outbreaks.
Dr. Kavita Patel, she's a primary care physician at Johns Hopkins Medicine.
Majority of people do not present with any active symptoms of Zika virus.
Their expertise for one cause.
Doctors at Johns Hopkins Medical Center in Baltimore are beefing up the battle against the Zika virus.
Anything that starts affecting our children, the panic level skyrockets.